Hello friends, welcome to Expert Medical Coding. In today's video, we're going to learn about ICD-10 CM updates 2025 first quarter part 3. In this video, we're going to cover mitral valve regurgitation with stenosis of bioprosthetic aortic valve. So before moving into the coding clinic, let us see some medical terminology which will be helpful for us to understand the scenario more better. Mitral valve regurgitation. Mitral valve regurgitation is a condition where the mitral valve in the heart doesn't close tightly, allowing blood to leak backward into the left atrium when the left ventricle contracts. Aortic valve stenosis. Aortic valve stenosis is a condition where the aortic valve becomes narrowed or obstructed, making it harder for the left ventricle to pump blood into the aorta and out to the rest of the body. Bioprosthetic aortic valve replacement. Bioprosthetic aortic valve replacement is a procedure where a diseased or damaged aortic valve is surgically replaced with a biological valve made from animal or human tissue rather than a mechanical material. Bioprosthetic valve endocarditis. Bioprosthetic valve endocarditis is an infection of a bioprosthetic heart valve. This infection can occur after valve replacement surgery and is considered a life-threatening complication. Bioprosthetic valve stenosis. Bioprosthetic valve stenosis is a condition where a bioprosthetic heart valve becomes narrowed or obstructed, restricting normal blood flow through the heart. It mimics native valve stenosis but happens in a replaced valve. Now let us go to the coding clinic. And the question here is, a 59-year-old patient with a history of aortic valve stenosis, status post bioprosthetic aortic valve replacement, is admitted due to persistent fatigue, chills, night sweats, and abnormal labs. Cardiac workup revealed bioprosthetic valve endocarditis, moderate stenosis of the bioprosthetic aortic valve, and moderate mitral regurgitation. ICD-10 CM classifies unspecified multiple valve disease as a rheumatic disorder. So would mitral valve regurgitation and stenosis of the prosthetic aortic valve be assigned a code from category I08, that is multiple valve diseases? So what are the appropriate code assignments for the mitral valve regurgitation in a patient with stenosis of a bioprosthetic aortic valve? And the answer here is, we have to first assign code T82.6XXA, that is infection and inflammatory reaction due to cardiac valve processes, initial encounter as the principal diagnosis. And also we have to assign codes I33.0, that is acute and subacute infective endocarditis, and code T82.857A, that is stenosis of other cardiac prosthetic devices, implants and grafts, initial encounter for the stenosis of the bioprosthetic aortic valve, and code I34.0 for non-rheumatic mitral valve insufficiency for mitral valve regurgitation. Stenosis of the prosthetic aortic valve is not considered a valve disorder, but rather a complication of a device. Therefore, it would not be appropriate to assign code I08.0, rheumatic disorders of both mitral and aortic valves, to capture multiple valve disorders. Please like, share and subscribe to Expert Medical Coding. Thanks for watching.